Okay, ready, Carpo? All right. Hello, everybody. Thank you for being here. I'm very pleased today to have Mayor Walsh here, as well as Randy Wilkin from McNee and Andrew Fish from Center State CEO. Dr. Gupta is here as well. We'll bring her up. But we've been talking about the reality that we are at war with this virus on multiple battlegrounds. And right now we've been briefing everybody on the public health side of things, but at the same time we're trying to mitigate the damage due to this virus on our economy. And part of that we've heard from with various programming that the city and the county have been working on, but I want to bring up Mayor Walsh to announce a new initiative that we are working on. Mayor?
Thanks. Thank you, County Executive. I want to start with a nice announcement, which is that some of you may not know it's the County Executive's birthday today, so I'd like to wish the County Executive a happy birthday.
Mayor, we weren't supposed to talk about that.
Certainly, I'm sure not how he was planning on spending his birthday, but we're glad that he's here and glad that he's doing all of the great work he's doing for our community. On a much more serious note, I also want to acknowledge the loss of life in our community that we learned about yesterday due to COVID-19. On behalf of the entire city, we send our deepest condolences to the family. We also share our concerns and prayers for everyone that is fighting this virus at this time. I want to take this opportunity again to acknowledge and thank our healthcare community, our brave doctors, nurses, medical office staff, hospital workers, as well as our first responders. You are all truly heroes, and we are forever in your debt. I know I can speak for the County Executive and all our local leaders in saying we will continue to push and get the resources out to the front lines and get the support that they need as quickly as possible. And that's really the same spirit that we bring today's announcement to you. The pace at which our community and our businesses are experiencing economic and financial loss is staggering. The impact has been crippling on too many businesses already, so we need to respond equally fast with support to help them continue operations in the face of this great change. We started that last week by announcing the creation of the SEDCO Emergency Loan Program for small businesses. I'm pleased to announce that since we opened up that process on Monday, we've received more than 75 inquiries and 25 completed applications from small businesses just within the city of Syracuse. Our loan committee is meeting on Friday, and we hope to be pushing out money through the door next week. We're also in touch with a lot of other municipalities and communities. We're pleased that Onondaga County has established a loan fund for businesses outside of the city within Onondaga County. We're also providing technical assistance to Schuyler County, who's looking to do the same. And to the north and the south of us, the cities of Oswego and Binghamton have both established their own zero-interest loan programs. So once again, you really see New York State rallying in the face of this crisis. As we work to address the immediate needs of our business community, we also have to make a plan for how Syracuse and Onondaga County is prepared to exit the pandemic and kick our economy back into high gear. Joined by the County Executive and with the assistance of Center State CEO and McNee, I'm pleased to announce today the formation of the new Economic Resiliency Task Force. Its mission is to help guide the Syracuse and Onondaga County business community through COVID-19 disruption and to make plans for the resurgence of our economy. The members, smart and talented people already working hard to support their own organizations and businesses, will share their expertise with us as well. We've identified the following members, all of whom have already agreed to participate. They are Nate Andrews, President of Morse Manufacturing, Calvin Corridors, Regional President at Pathfinder Bank, Jeff Davis, Partner at Barclay Damon, Joanne Gagliano, President of Environmental Design and Research, or EDR, and Chair of the Syracuse Regional Airport Authority, David Hoyne, owner of Kitty Hoynes, Evelyn Ingram, Director of Community Relations at Wegmans, Jeff Knaus, Chief Executive Officer at Digital Hive, and Loretta Zelkowski, Executive Director of Human Services Leadership Council. We certainly weren't able to have all industry sectors represented on the Resiliency Task Force, but we certainly intend to work with every sector, starting with our healthcare industry and our educational and medical institutions that, again, are on the front lines here. We will also draw, in addition to the staff resources represented by the principal partners, we'll be working with other partner organizations, including the Downtown Committee, Visit Syracuse, Empire State Development, the U.S. Small Business Administration, and the Central New York International Business Alliance. I want to thank this group for accepting our call and for all the work that they are and will continue to do. I also want to thank our partners, the county, Center State, and my friend Randy Wilkin, President and CEO of McMahon's, who will offer some additional thoughts. Randy.
So thank you, Mayor. Thanks for your leadership, as well as a focus specifically on getting our community back up and going. It's absolutely essential that we keep businesses safe today, and we have essential businesses as defined by the state open now. And it's important that this task force help those essential businesses and begin to prepare to help other businesses open. As you know, this is a threat not only to our health but our economy. We're going to need a coordinated response, and this task force put together by the county executive and the mayor is exactly what we need. But we'll need the support of the entire community and individuals specifically who work in these essential businesses to stay at work and to be safe and to be healthy. McMahon's is involved in a regional, in fact, a multi-regional effort to help essential businesses, manufacturers starting with, but many other businesses to stay open and safe. In fact, today we're announcing a brand new initiative led by business. We have 10 essential businesses already involved in it. You can find out more at our website at macne.org under the COVID banner. You'll find an opportunity to email us and let us know how you can be involved in keeping your essential business operating and safe. I share the need and I share the concern that's just been expressed that we'll need to come back up for those businesses that are not open today but working remotely. And I think it's important that we do it as fast as we can, but safely. Let me also say I want to thank the public officials during these difficult times. They're out on the front lines, and it's really important that we give them our support during this difficult time. We also have to get frontline healthcare workers, first responders, hospitals, and all those. They're on the battlefront right now with this war and the difficulty with this pandemic. We need to thank them. We also have to be cognizant of the individuals going into essential businesses today. They're open. They're making sure that grocery stores have product. Many of our members produce those products that go into grocery stores, pallets that can deliver things. These are the kinds of things that are necessary. We want to thank them. They, too, are on the front lines. I'm asking everyone to be kind and more patient given the difficulty that we have when you're standing in the checkout line for the grocery store. The clerk is actually on the front lines trying to be helpful to keep our economy open. I'll stop there. Again, I want to thank all that are involved. I encourage all of our team members and everyone in our community to be calm and stay safe, but to carry on. And I'd like to introduce Andrew Fish from Center State.
Thanks, Randy. These really are unprecedented times, and it's really scary out there for small business to think about how they're going to continue to operate in this environment where there's issues like cash flow, supply chain disruptions, lack of customers, and challenges that they just never thought that they'd be facing, 2 or 3 weeks ago. As a result of that, we're really looking for this resiliency task force not only to help small business and businesses in this community think about how to deal with the challenges they're facing today, but how do we move through that? How do we create solutions to help them get back on their feet? And how do we have our economy here in Central New York bounce back on the back end of this pandemic? The task force is really set up to do 4 key activities. One is to assess. We're doing that right now through reaching out to businesses in this community. We have a survey that is going to be made available to any business in this community that wants to participate, that identifies some of the challenges that they're facing. Then we're going to respond to some of those challenges. Some of those things have already been taking place, workforce challenges, companies having layoffs, but also companies looking to hire and making those connections directly between those workers and those companies so that people can get back to work and fill that current demand for those essential workforce industries. Issues around critical supplies. We've had companies throughout Central New York generously donate masks and other things to the healthcare industry, and we've been able to see those connections happening simply by people raising their hand and saying, we want to help, or people raising their hand and saying, we need help. And that's really what that assess and respond phase is looking at. But we have to do more than that. We're going to transition into mitigation. What are the opportunities that are presented through the federal stimulus bill, through the great work that the county and the city have done by repurposing some of their loan programs to be rapidly deployable and available for for small businesses and their needs, and what the state is doing through Empire State Development and its work with the Small Business Administration. All of these things are ways in which we're going to be able to get through this crisis with small business. And then the last thing is recovery, and that's really going to depend on all of us in this region stepping up, supporting our industries, supporting our businesses, supporting each other, and having a real focus on how we reinfuse this economy. When I think back just a month or two ago with all the positivity we were having, all the great wins that were happening in this region, it's really encouraging to me to think that we can get back to that place. It's going to take a long time for us to get there, but through the partnerships that we have with the county executive, with the mayor, with McNee, with the business community, and all those that are stepping up at this time, it is possible, and I think we're going to get there. So we're asking people to respond to those surveys, to reach out when they have questions or challenges. We've set up a general email at centerstatessupport@centerstateceo.com for companies to reach out with any of those questions or concerns, or if they have something they'd like to do to provide a service or looking to help in some way, shape, or form. So we're excited about this task force. We're grateful for the partnership and the leadership, both from the city and the county. And with that, I'll turn it back over to County Executive Ryan McMahon. Happy birthday.
Thanks, Andrew. Thank you. I appreciate the birthday wishes. I think it's important to note that part of this task force and really being able to supercharge this task force and our economic recovery, which is something I think we're all dying to get to, we got to deal with what's going on right now, and we need everybody's help. So we are very pleased today to see the United States Senate come to a deal. It still needs to pass the House, but the deal looks very promising. It looks like there will be a bump in unemployment insurance. Essentially, what the old percentages you would get when you're unemployed will now be higher. You'll be getting more income if you recently lost your job. Certainly, we're very happy to see $150 billion for hospitals nationwide. Some of that will get back into our hospitals. Our hospitals, because they are not doing elective surgeries now, are essentially losing money in this process. So this will help them. Certainly, there will be some more relief for states and local governments. There was a $6 billion bill that passed Congress already to help with more Medicaid funds for the state. That would actually help the county too. Those funds are already there. This will produce more funding for the state and for localities. We don't know how that breakout is for localities, city, county, whatnot yet, but certainly we are spending a lot of money right now that we did not have budgeted due to the pandemic. So these are all important things to help governments continue to do what we're doing, but also to continue to keep people employed. Our budgets are done. Our ability to raise revenue is over. So I want to thank Senator Schumer for his advocacy, Congressman Katko for his advocacy and continued leadership on this. Focusing in on the health side of this for the numbers, we know we're going to get some busy days coming up, and we have one. So the reality of this disease is it spreads, and it spreads quickly. That's why we need help. That's why we've made decisions we've made to date. Let's go over some of the numbers. We currently have 81 cases in Onondaga County. That's up from 60 yesterday. This is a 35% increase in one day. This is various test results coming in at various periods of time. We've talked about test results from the beginning of last week, that log jam. We can get into that a little bit more. We also now have testing that's being turned around within 24 hours. Let's talk about what's going on and who these people are, because I'm getting to the point of frustration with certain parts of our community now. We have 40 females and 42 males. We have 73 individual cases with 8 contacts. What a contact is, that is someone we've put under quarantine, and once you're under a quarantine situation, there's a higher probability that you will test positive for COVID-19 because you've had direct contact with someone. 8 cases are still linked. We got 21 new cases over the course of 24 hours. We're sure after a thorough investigation is done, we'll see more cases that will have some sort of linkages to them. We have 3 individuals still under 19. That number's not changed. We have 20 individuals in their 20s, 10 in their 30s, 9 in their 40s, 11 in their 50s, 12 in their 60s, 10 in their 70s, and 2 in their 80s. We have 10 individuals in the hospital. We have 3 in critical condition. We have over 248 people under mandatory isolation and quarantine. 41% of our positive cases are under 40 years old. And we really need people in this demographic to really reflect on their behavior. And their behavior may not just be, I went to spring break, I kept my vacation with all my buddies, and we went out skiing. Your travel patterns matter. We know we live in central New York. We know that there are hot spots in New York State that are as hot and burning hot with infection than anywhere else in the world. And yet, we continue to see people traveling to New York City and back and forth. That is a risk to this community, and we need everybody to do better. We have 55% are under 50. 71% are under 60, and 29% are over 60. Breakdown by geography: the city of Syracuse, 27. Salina, 9. Clay, 9. Cicero, 6. Onondaga, 5. Camillus, 5. Manlius, 5. Skaneateles, 3. Lysander, 3. Pompey, 4. DeWitt, 1. Geddes, 1. Lafayette, 1. Spafford, 1. Van Buren, 1. This disease is here. It will be in every town in our city at some point. How we react and flatten the curve is up to us. This data, what does it mean? There's no surprises here. We knew as we got more tests back, our numbers would increase. The faster we get the tests back, the better we can identify quarantines. This is the strategy the whole time. We have been in a situation where we have been doing robust testing. We're very pleased that now the turn times seem to be better, and we're getting data back quicker so that our 40-plus investigators can go and do their job and figure out who needs to be under quarantine. Let me just talk about quarantine real quick. If you go and get a test, I'm assuming that you are sick, and I know that to be true because a doctor would have to tell you, or you get screened. Once you get a test, now's not the time to go rogue and not answer your phone call, okay? So if you get a test, and many people are waiting anxiously on their tests, but we need you to stay in communication because when we're trying to reach out to you, if you're positive, we need to communicate with you and communicate quickly. Also, when you're under mandatory isolation or mandatory quarantine, mandatory is the word you need to understand. It is against the law to do anything outside of staying in your house or going on your front porch or your backyard. If you need help, we will help you get whatever you need. But we do not want to be in a scenario where you break a quarantine and when you are done with your quarantine or you get better from COVID-19, that your first stop is not out to your favorite park, it is to jail, okay? So we take this very seriously, and if you break a quarantine and you put the rest of the public at risk, you will face charges, okay? We went through yesterday some areas where we were still looking for help from the community. Bethany Baptist, 149 Beatty Street in Syracuse, a person who attended Mass at 11 a.m. On Sunday, March 15th, has tested positive for COVID-19. The update there is we updated the media yesterday about 11 a.m. There was earlier masses there. So anyone who went to church that day at Bethany Baptist, please reach out to your doctors. If you have any symptoms, talk to them about if they think you should be tested, certainly. A couple other things with testing. As more and more people test positive, employers are making the decision to communicate with their workforce, and that's appropriate. If you hear from us, that means that we have deemed you should be in a quarantine or we need to ask you questions. If you hear from your employer and you don't hear from us, the county health department, we have deemed that your contact, if at all, was not under a period of time where the individual had symptoms. So this is part of what we've been talking about where things are going to get real and they're going to be uncomfortable. We're going to have people become positive who work in places that other people work, or they worked at places that at one time had a lot of people in those buildings. Right now, a lot of these buildings have been empty for well over a week. So this is going to be uncomfortable. And the communication from your employers will be there, but if you don't hear from us, we are comfortable with our investigation, and those who should be in quarantine are in quarantine. I think that's important, as more and more of these cases are going to come out and more employers are going to communicate with their staff. Testing numbers, we have close to 1,550 in Onondaga County. Again, 81 positive. The percentage, a little over 5% today. That percentage has been really going between 4 and 5% of the amount of people who test positive for COVID-19 in our community. We believe, mind you, at the Community Health Center, where most of the testing has been done, that has been a testing site for multiple counties, and we've seen patterns. When Albany was short on testing, all of a sudden people from Albany were showing up. Last week, Erie County had some testing days where they were short. Erie County residents all of a sudden showed up. So we're seeing these patterns happen across central and northern New York, and even parts of the Capital District in western New York at times. So when we talk about tests at the triage site, 20% of those tests are for other communities, the central New York communities or northern New York, and in some cases other parts. Because we're ahead of the curve at this point, certainly the labs did receive a backup on the 16th and 17th and the 18th of last week. We went over this yesterday. If individuals are still waiting for a test, we believe today and tomorrow this backlog will be gone, but certainly we have capacity. If they're waiting for a test and they want to come get tested again, that test will probably turn around in 24 hours. We can do that. I know people have been waiting. If you want to come get retested at the triage site, now that it's a 24-hour turn time, that's fine. Certainly, just like when we had a spike with over close to 700 tests in 3 days, that was backlogged. That went to one lab that got really inundated. The regulations changed for this company last week. They could open up another lab closer to us. Now the turn times are quite quick. But certainly, if you're one of those cases that have been reaching out to my office, where you went last Monday or Tuesday or Wednesday, and you are still symptomatic and you want to come get another test, please come get another test. Okay. Again, there's no curfew anywhere in Onondaga County at this time. That's a rumor. Again, thank you to our media outlets for reporting on the various scam artists who are despicable, who are out there right now. Our investigators will never ask for your Social Security number, nor will anyone else when they're communicating you on behalf of the government. So please be wary of these scam artists who are trying to take advantage of us in the middle of a pandemic. Triage line, over 6,900 calls for assistance. Coronavirus assessment tool with our digital alliance with Microsoft in the city of Syracuse and Syracuse University and Upstate Hospital. This algorithm tool, the coronavirus assessment tool, over 27,000 people have taken advantage of this. We talked a little bit about the stigma of the test. Yesterday, I told you how Dr. Gupta does not let me talk to anybody, and she doesn't. I actually received an email right after that from one of our positive cases saying I can call him at any time. I had a nice conversation with him. He's feeling well, and certainly, these are our neighbors. They caught a disease that right now we don't have any solid treatment for yet. We'll get there. We're buying time for our medical community, but there's no reason that these folks should be treated any differently or should be treated unfairly because they're sick. I think we're doing a really good job in our community recognizing that. Hospitals and surge capacity. The governor gave a goal for hospitals to increase their 50% surge capacity in the event of being needed to perform. Our hospitals have all done this, and they met and they'll follow the state approval guidelines for those. We're reviewing those plans. We've identified a location for a additional surge site. These discussions are ongoing right now. We're not going to get into the specifics because we don't have a contract done yet. But what we're looking at as a community is the governor has said, hospitals, you need to increase your capacity in your ICUs to serve sick people with COVID-19. That's part of the plan. In addition to that, we are looking at, in the event that we had a widespread community spread, an additional surge site for ICU beds. We hope to have the proper legal agreements done so then we can talk about those. But at this point, the status on our emergency rooms and ICU beds was the same as yesterday. All the hospitals are in very good shape and are ready to serve the community. Message to caregivers and parents, again, thank you for your partnership right now under these trying times. Each day gets a little bit harder. I understand that. If you need help, please contact 211. Folks from our social and emotional task force are there. They're here to help you get through this and talk through these things. Again, thank you. You are on the front lines of our social distancing platform. Without you, we can't starve the virus. Again, I want to thank kind of our behind-the-scenes army of folks, all of our volunteers in the healthcare industry, all of our first responders, all of our essential business employees that Randy talked about earlier. Certainly, we are plugging in people into roles they were never in before as new vulnerable members of our community need help. We have seniors now that can't go to the grocery stores. And we are plugging into these new challenges. And for this period of time, government will be the support role. That's the role we have to play, and we're doing that. We've received 1,600 separate calls for assistance in 1 week from our senior nutrition and healthcare first responder line. When we get those calls, all hands are on deck. We have volunteers. We've got members of the county government. We work with other governments. Members of my staff go out, and we do what we need to do to make sure our neighbors get the help they need. Children's nutrition update. In 6 days, 122,000 meals have been distributed to our school children. That's amazing. That's over 20,000 meals a day in the community, where we're guaranteeing that our young people out of school are getting a hot meal. That's a big deal. We're very proud of the plans that got in place with our school districts. Daycare right now for essential businesses, emergency responders, and our healthcare workers in this period of time is free of charge. In less than a week, 388 medical personnel and essential staff have accessed this free daycare. That allows them to keep working and allows our hospital infrastructure to hold up. We're just very, very pleased with our partners at Child Care Solutions. Again, if you find yourself in this situation where you need help for daycare to go to work, our phone number for Child Care Solutions is 315-446-1220. And again, with donation of goods, we really want to thank all of the local businesses who continue to donate and want to donate food, different PPE, and supplies and equipment for our emergency management supply chain. The email for that is EM, Emergency Management, web01@ongov.net, or you can call 315-435-2525. The community is doing well and really donating. And I think the mayor, I can speak for the mayor too, it was fantastic to see that the community fund for COVID-19 is almost at $1 million now. What a remarkable way for our community to rally and really help support our nonprofits that are going to be hurting. And so all of this stimulus and all of this giving is all about keeping people employed to do the services we need them to do to get us through this, and then so our economy can recover on the backside. So saying that, the mayor is here, I am here, Dr. Gupta is here. We will take questions. Yeah.
talk a little bit more about the 8 connected cases? What do you mean by that? Are they all connected to the same person?
Yeah, so the 8 case, what I mean in 8, and I'll give a little bit of detail in my conversation I had with the one individual yesterday, and I think this is helpful to the public, this conversation that I can share, is he was not feeling that sick, but then he received a call that this individual that he may have been in contact with had COVID-19. So he said, geez, I'm not feeling really that sick. I'm going to go get tested. He then got tested. He had a positive test. So right now, his symptoms are still mild, and he feels good. He feels okay. But so he is one of our 8, where we found one positive connected to another and whatnot. That number is bound to go up as we go through the investigations, determine all the quarantines. That's number 1. Determine the quarantines, get them in quarantine, and then our investigators can start comparing all of the different cases and where put together that tree and that puzzle.
But it's not 8 cases all traced back to one individual.
I don't have those specifics, Tim, but that's not my understanding.
Also, you mentioned travel back and forth to New York City. Do we know of any cases that? Well, there was one early on.
Yeah, I think we know at least 3 cases that were New York City related. I know that there's at least 3 other cases that were travel related. And the risk now today of travel in New York City in more cases is larger than it's ever been. More people have it now than they did 2 weeks ago. So it's a serious situation. A lot of people have second homes throughout upstate New York. We're in a situation where folks may want to leave downstate New York, A, to get away from it, but B, they may be carrying it, or maybe they want to use the infrastructure that we have in upstate New York. It's a serious concern and a valid one that these communities in upstate will need more resources if this is a trend to stay ahead of the curve on testing. Many communities haven't been impacted, and a lot of these communities in upstate don't have testing. We've been able to keep our testing going, but what you don't want to see is a contained situation south of the Hudson become a complete statewide problem.
Should travel be limited by edict?
I think it's something that it's a fair question for our state officials at this point to consider. We will not be making that decision at the local level. We will share our concerns with the state officials. That's something that certainly the governor I'm sure is thinking about as he's assessing the situation in the state on a daily basis.
In your remarks, you seemed the most frustrated by both the implication that people aren't following the mandatory quarantine. You reminded them that jail is a consequence.
Yeah.
And people going to hot spots still and coming back. Have you seen a spike in these examples? What's leading to the spike in your frustration?
Well, the spike in the numbers in their 20s, one. The stigma is that seniors get this, and that's not what's happening in Onondaga County. We still have senior citizens that are testing positive, and we know via behavior and social media and everything else that individuals in their 20s were still going on vacation, still going on breaks, still socializing, and they have not taken this serious. Our hope is that you take it serious now, because it's not, look at these 20 individuals will probably all recover. What I'm concerned about is the 40 or 50 people we have quarantined because of these 20 people, will they all recover? And that's something that I'm not saying all these 20 people did something wrong, but what I'm saying is right now we know very well that there are hot spots in this country. And we know you can go into these hot spots, and due to the density, you are at a higher risk, and then you travel home. So let's be smart. Let's stay home. And certainly, if you are not feeling well, we need you to stay home. And if you're a quarantine, by law, you need to stay home, and you need to stay in touch with our health department. And that means picking up your phone. That means staying in contact. because we don't need to be sending people around chasing you or going to your house because you aren't answering your phone. And and I'm warning this, and I'm being stern today, Andrew, because this is these are larger numbers, and we know the numbers are going to get larger, and the larger the quarantine numbers get, it's harder to manage. We don't need to be spending time babysitting and making sure people are listening to the quarantines when we need them out investigating positive cases and starting to flatten the curve.
Do you have the power as county executive to do what the governor of Florida did and mandate that if you travel from New York City, you have to isolate for 14 days?
I don't believe I do. I think the governor has put out an executive order that says at this point moving forward, anything related to health of COVID-19 I can do it. It needs to then get approved by Commissioner Zucker. And that's not, I don't want to go there without consultation and an overall strategy for the state. That you don't go do that by yourself. You do that in coordination with the whole state, because there's a lot of other counties, and you can go into one county, drive around. We live in a pretty mobile community. I'm not going to speak for the governor. I don't know what numbers the governor is looking at. I know I am pleased with some of the things I'm seeing in the stimulus bill. And I'm pleased with the recognition from the federal government that it's not just the states that are spending a lot of money or the states whose economies are getting, whose budgets are getting blown up because of this. The mayor's budget is getting blown up because of this. My budget is getting blown up because of this. So we need to be part of that conversation, because this helps us continue to provide the services and keep our employees employed.
Back to the quarantine issue. How stressed is the health department and those investigators going out to people's homes because you can't get in touch with them? Or has anyone broken the quarantine that is at risk of arrest?
We've had some slower communication, and so nobody's broken quarantine, but we have individuals who are not communicating in a timely basis with us, and we can't have that. So you need to be accessible. When we call you, you need to call us back, not 4 hours later, 5 hours later, 6 hours later. You need to call us back, or else we're going to send somebody over to make sure you are where you should be. And that's not what we need. We need the community to be our partner here. All we want to do, we're doing all of this to make sure nobody gets sick, and to flatten this curve and to starve this virus, right? We're looking out for your health. And that's our frustration when certain behavior is not acknowledging how serious this is. This issue is more serious than anything in modern history at this point. I got an email from Congressman Walsh, who was our congressman, one of the individuals who got all the funding for New York City after 9/11. And he told me this crisis is much more severe and much more complicated than what 9/11 was. And 9/11 for the mayor in our generation, that was the key event in our generation. So we need everybody who's the same age, 21 and 22, when the mayor and I were, when September 11th happened, we need them to realize this is uncharted territory. Take it seriously. Be part of the solution. Be leaders. Lead.
Mayor, I have a question for you. I know you probably don't want to, admit to a favorite business in the city of Syracuse, but I'm seeing specific posts from, Lacey's Tapas Bar, which has tried to go and now they're shutting down. Other restaurants didn't even try the to-go because they couldn't sustain it. Have you heard from somebody specific that just exemplifies the hardship that these restaurants, small businesses are going through, and basically inspired you to offer the loans last week and now this task force?
There's so many stories of it, Andrew, and those stories change by the day. There are businesses, as you pointed out, that have tried to make a go of takeout and just haven't been able to make it work. There's businesses that have shuttered for what they thought was a temporary period of time, only to realize that they're going to be shuttered permanently. That's why we felt the urgency to establish the emergency loan program. That's why we felt the urgency to establish the Economic Resiliency Task Force. I've tried to go out of my way, since I have to be out and about anyways, to frequent as many local businesses as I can. They're all making a go of it, but the reality is some aren't going to survive, and that's why this support is so important.
With the retesting process, what is constituted as recovered, and are you guys retesting people who their symptoms may have gone away?
Yeah, so we don't test anybody. We're the government. What we do is fund a triage testing site and work with all of our partners at the hospitals to make sure that they have the materials they need for testing. And if they don't have the materials, we go and get it for them. So it's county government doesn't do testing, okay? What we are saying is that if you went to the triage testing site on Monday, Tuesday, or Wednesday, I believe if you went on Monday, you've received your tests. I believe. That's what we're being told. Tuesday and Wednesday. Tuesday was our busiest day we've had in Onondaga County. If you have not gotten your test back and you're still not feeling well, you can go again now and get tested again, and it will be a quicker turn time. You may get a call from two different results on the same day. So that's part of a solution now to people who are waiting in limbo. Go down and get tested, and you can get tested again. The turn times now are faster.
But the people whose symptoms are going away, are they being retested just to confirm that it's actually...
If your symptoms have gone away, you'll probably get a call tomorrow, if not today, with your original test results. The test results that you originally had that you're waiting for are still going to come.
Ryan, the 248 people in quarantine, mandatory quarantine, those all relate to positive tests, or does that include people who have been tested and are still waiting for a result?
That number, these are related to positive tests. We do not include the people who have been tested waiting for the results who are under a quarantine as well.
And remind us what the penalty is for breaking that.
A Class B misdemeanor.
Has anyone broken that?
I have not been told of anybody breaking that. Yeah, look, I think we got to start, and there's a great, the task force is tremendous business leaders from various parts of the economy. I think, Rick, part of the challenge, too, with businesses as this goes on a little bit longer is some of these businesses who are deemed non-essential, is there a way that your business can adapt where the social distancing can be implemented, where you can maybe get a waiver? I've been having conversations with some auto dealers related to going online sales. There's hundreds, if not thousands, of people probably watching this right now that have a car lease that may be coming due. They still need to get a new car. That's a sale, right? That's a generated sale that creates revenue and economic activity for this community. If these car dealers can go online for online sales, can't we develop a process where they can get back selling cars, right? So I think part of this is obviously there's many businesses that are just, there's so much contact, person-to-person contact, that they are going to be out of commission for a while, and we need to focus in on that. And a lot of these stimulus packages, a lot of the details do focus in on some of these businesses. But there's others that this task force can help work with to get to potentially get waivers for you to get back in production and doing what you need to do. Look, at the way these payments come in, it's almost like a 4 to 6 week lag. And so my guess is sometime at the end of April, we'll see that first payment, which is really this week. I think this week will be the first week that we will see solid negative growth, right? Even the week where everybody was behaving badly, but grocery stores sales are up 10,000% and whatnot. We get some sales tax on some of that. So I think even those weeks we'll do okay. But we are estimating that depending on how long this goes, you could have negative growth anywhere from 4 to 12%, which is devastating.
And while this is going on, how much has this cost the county extra so far? Can you ballpark?
I think we're getting close to $1 million of unbudgeted COVID-19 costs. Basically, buying materials that we need to buy, and buying supply chain materials for nursing homes, hospitals, and whatnot. Our hope is some of this will get reimbursed through FEMA, but we believe it should, but we'll see when we go for reimbursement.
You ready for the good news?
Is there another question before the good news, or I see a couple more? But
yeah, I got more bad news.
Okay, all right, thanks, Tim.
But I think if there's an answer to this question, it might help people understand what the risk is a little bit. We have 81 confirmed cases, but we know there's a significant lag in when we learn of those cases. Those people got sick last week. Has the health department, and I'm seeing in other communities, there have been estimates that 20 to 30 times the number of positive cases are probably sick at the current time. Has the health department worked up any estimate like that to guesstimate at how many people right now in Onondaga County have COVID?
Dr. Gupta, do you want to talk about that?
So I don't think we can do any modeling it, what the speculation, based on how the lab data is flowing back to us. There is a backlog. That's what we have been seeing. We received one today and few yesterday from 16th. The lab tests came today. So all these things, but then some of them we are getting in 24 hours. So until we have some of those called sort of a missing ones in between, there was a lag, which we have been talking about, that they were sent to California, then they were in Pittsburgh and all those. So there is a lag in some of those cases which are coming now. Right now, the way we are seeing, the way testing has been done, it's pretty much correlating how we will start to see. We just want to have all those tests from few backlog. If that answers your question.
So Tim, one of the charts, yes, I've asked for this one to be right here. That shows the spike. The spike right there is Tuesday, Wednesday of last week. And so those are the tests. Once we have that data back, our hope is that will get us to the top of the curve, and then you see the spike go down, and you've seen 4 straight days, essentially, of the same testing demand going down. So our hope would be that we know this will probably look like this in the short term, is that we're moving up like this. You're going to get to a spike when we get that data from last Tuesday and Wednesday, and then you're going to start seeing something a little bit more like this. When people start to get better, then you'll start seeing it come this way a little bit, if, and only if, we social distance and don't do anything stupid. What could change all of that is we could start to see the end of our curve, and then all of a sudden we have people going out traveling again to hotspots, coming back, infecting their workers, their colleagues, their families, and then we go through this cycle again. And so I think we are looking at that as a sign of potential hope, recognizing the data changes very fluidly. Dr. Gupta?
So I think the probably you're trying to allude to, because we have so many people in quarantine now, our concern is within 14 days, would they develop symptoms? And that's what we keep our fingers crossed. So if even half of them developed a lot of cases, then we will have a spike.
Yeah, and I understand the optimism of that chart, but I also see the death rate doubling every day in New York City.
Right.
And so I'm...
So, no, you have a very valid point. That the thing is, when we are seeing so many people in quarantine, out of one case, they could be 0 contact, they could be 15 or 30 contacts, depending on how many people are in mandatory quarantine. It means they should be staying home, and they should be monitored for the fever, any symptoms. And out of those, how many become positive? Right now, what we have, few of them, very small numbers. But would that happen tomorrow, day after? So we have to continue. I don't think I would like to speculate at this point. That's why the message of social distancing is so important, that we cannot go back in time. We can go forward. Going forward means we do everything in our power to make sure we are just following all the recommendation which is coming off their ways.
Dr. Gupta, while I have you up there, patients who tested positive for it, are they being retested once their symptoms go away?
Right. So what we are in a process of finalizing what we will be doing, because we are reaching at that point in some of the first cases now. CDC has the guidelines in terms of whether we want to adapt no test strategy versus testing strategy. Usually for the no testing strategy, you have to have a fever for no fever for 3 days, and they have to be asymptomatic, as well as from the first day, 7 days, you have to have no symptoms. So a lot of those things we have to put really clear-cut guidelines for us. If we choose the option of testing in some situation, then it has to be 2 negative tests in 24 hours. And that's now, it used to be oral and nasal, now that will be only nasal also. So we are going to finalize that and how we are going to adapt, because we have to release people from quarantine and isolation. So it's work in progress, and we will be able to update you.
How many tests now are we up to total?
We were getting clarification. There was a number, 1550.
Well, that's results.
Results. Yeah, I think we're getting some clarification on, there was a number 2,400, Tim, that we wanted to see, though, if some of those had other counties in that number. But max would be 2,400.
The governor today reported us at 1338. Do you think that was just the ones with results as of yesterday?
Yeah, their data's a couple days behind what we're going. And again, we understand how important the data is to the public and how important it is to us to make decisions. So we are extracting data from all of the providers and the hospitals and everything by 3 p.m. so we can give the most accurate update that we can.
So this chart is from the triage center, but are you seeing that same trend
Yep.
of fewer tests at the hospitals?
Yeah, part of what each day the hospitals are giving us reports on how their emergency room and their ICU rooms what they look like. In addition to that, how many tests they've done, and then we know the positives. They share their positives, but Dr. Gupta knows the positives before they do. So we get this information each day from the hospitals and the triage site, and we by 3 o'clock try to put it all together for you.
With the task force, so we're saying you guys will provide resources, financial assistance. Can you elaborate a little bit for businesses what they can expect to get with this?
Mayor.
Sure, yeah. So we went through the process. The first phase is just assessment. So right now, led by Center State, we have a survey going out to all the businesses to understand the universe of challenges. From there, we then take that information. We try to align it with existing resources, so whether it's the SEDCO Emergency Loan Program, the county's loan program, the SBA program, inventory all of those resources, try to make matches with the businesses and their specific challenges, but also identify gaps in the support services and advocate aggressively to fill those gaps, whether it's through local resources, state or federal resources.
Other questions?
The Community Health Center now has a new lab they're sending results to, or are they working with 2 now?
Yeah.
Quest and
Couple, a new lab partner as well as Quest.
Okay.
And again, we're out there looking in the marketplace at all times. When we find that lab that can make us perform at a level that we want to perform at, which would mean we can test and know the results very quickly, so Dr. Gupta and her team can do their job very quickly, we will pivot to that partner as well.
Are you at a point where you're able to prioritize certain people's tests? Like, if a nurse comes in, you can fast track their results?
Yeah. So there is a very particular way we do that. If there's a healthcare worker has been exposed, or we certainly have a very specific process where we can have that expedited, and that is a priority for everybody to know.
Is that the only category that would be expedited?
So healthcare professionals are not only doctors. You're talking doctors, nurses, any other people who are involved in the care of a patient that will be considered healthcare worker. And because there are implications of their exposure, so that is very crucial for us. That goes case by case.
Certainly, we look at emergency responders too, Tim. We haven't been working with SPD scenario sheriffs, our EMS folks too as well.
Hey, you mentioned that some employers might notify their workers if there had been, a positive test at the workplace or something like that. I'm still hearing a lot of anxiety out at the airport that I guess I would say employees are not trusting that is happening.
Well, I know they wrote a notice to him because our health department helped write it. So I don't know what you're hearing related to that. I haven't heard any of this.
To everyone, or
I'm pretty sure the airport authority commissioner put out a notice to the employees. I think I might even read that on Syracuse.com. I thought we helped communicate that message with him. And we do that with employers. If they have questions, they want to use the right language. They don't want to say something that's inaccurate or untrue. And specifically, I think I read one today about Cicero North Syracuse on Syracuse.com about they did a very good job with writing, we're letting you know this. If you don't get contacted by the health department, then you have nothing to worry about. And so the reality is this is where it gets uncomfortable for people, because we're all going to know somebody soon. If we don't already, we're all going to know somebody in a quarantine, or somebody who you have heard has been tested positive. And we had a county employee test positive, Tim, and she had international travel. And so now our communications certainly went out to the department, and we're going through our protocol, and I'm getting emails from employees who are nervous. This is what's going to happen. This is tough. And it's tough for people when the medical professionals are saying to you, we've done our investigation, you don't have anything to worry about. If you do become symptomatic, please contact your doctor. And people are so nervous that it's tough for them to accept that answer as a true answer. And I appreciate that. And that's why we talk about mental health throughout all of this. But the reality is Dr. Gupta and her team and the rest of these medical professionals, their job is not to be ultra conservative in their quarantines. Their job is to make sure that we identify the risk and we kill that risk right where it stands. So they're going to be more cautious and put more people into quarantine than less. And so that's, I understand the anxiety. We're going to have large employers that are going to have people. People are very concerned anytime they hear about an employee who worked at a school. I get it. Trust me, I get it. But right now, we don't have any children that have tested positive, and schools have been out for over a week. And so, from that standpoint of a community spread in schools, that has not happened. Anything else before we get to the good news?
I actually have a submission for good news.
Okay.
It's from an inside source named Kate McMahon.
Oh, boy.
She writes, Ryan, you are an incredible husband and father. As soon as this is over, we will go on our planned weekend getaway to celebrate. So the good news for today is that it's your 40th birthday. You are healthy, strong, and leading our community in a very challenging time. Love, Kate, Jack, Maddie, and Andrew.
Well, that's very nice.
And I'll clarify, it's your son, Andrew.
My son.
Reference there.
Yeah, thank you.
And I can also confirm that your favorite dessert is waiting for you, key lime pie.
Oh,
tonight.
excellent. That's very good news. And certainly I believe that this community, in the leadership in this community, has responded very, very well, and working together every day as we get through these uncharted territories together. And I also want to bet, Andrew, just so you know, many of my friends bet me a long time ago I would never make it to 40, and I did. So that's some good news as well. Thanks, folks.